what is menopause? And then if you have to have menopause, how to come as a victor, how you reinvent yourself. That's what you're going to learn today. With me, Dr. Jones Bailey. She has a practice in Atlanta. It's a Buckhead functional medicine. She has been OBGYN specialist for 25 years, and then she moved to functional medicine. She's been doing functional medicine for the last 15 years, and one of the best in the Atlanta area. And then with me also, I have two executive person who basically have firsthand going through the menopause. So I thought instead of reading the book, we're going to bring a book to you and you can hear from them themselves. I have Miss Dawn Dobbs, who worked with me in Athens Heart Center. She's been with me for the last 20 years. Seneca Garrett, who is also, and I would bet you were not able to tell how old she is, but she run a multiple business, work 10 to 12 hours a day, and full of energy. She going to tell you her story about the menopause. So tell us, what is menopause?
Menopause is a natural transition for women. It is a point in time where the periods have stopped for 1 year. If you look at the Greek definition, meno is monthly and pause is cessation. It's a natural transition that all women experience. If you have a hysterectomy, you will experience it at the time of the hysterectomy because the uterus is removed. 55 million women are menstrual age now, and 6,000 become menopausal daily. And menopause can last between 2 and 14 years, but it typically will last about 4 to 7 years. 85% of women have symptoms.
So tell us about the changes, hormonal changes in women, starting from age 13 till they die.
Yeah, hormonal transition is very much a part of our lives as women. Starting with our first menstrual cycle, which on this particular graph, that would be early on the far left, -5. Those are the early hormonal changes that we experience in maturity when we're able to then become mothers. And from that point on, we go into the reproductive years, childbearing years, and then perimenopause, which happens right before the period stop for a year. Menopause, now we're in the middle of that red circle. And then postmenopause, which is after the 1 year period of time. And we are experiencing hormonal changes and symptoms all during that time. And this slide will show you what some of the testing can be to look at what's happening at each of those times, as well as some of the symptoms.
So you mean we can tell you what stage you are by checking your hormones or checking your symptoms, is that right?
The combination of them both.
So Ms. Dawn, tell us about, did you know about this, what's going to happen to you, or it just came in without any notice?
No, I had no clue. I thought I was going to be young and beautiful forever. So when I started with symptoms, I really didn't put 2 and 2 together. I didn't really put 2 and 2 together or really figure the situation out until probably a couple of years in. But weight gain started, sleepless nights came, then, you get night sweats, you get hot flashes, irritability, your mood changes. And then, at that point, I decided to start talking to somebody and try to figure out what's going on. And it was definitely, middle stage menopause. I'm in that transition.
So, Seneca, was it a surprise for you or you knew it was coming?
I knew it was coming. I would think that my biggest issues were the night sweats and just, I felt like an oven was turned on inside of my body from the waist up to the top of my head. It's like, what is this? Clothes were wet. Just didn't want anyone touching me because I just felt hot all the time. And I did deal with a lot of sleeplessness, some depression, and but some of the other issues that most women have, I didn't have any of those. And I think that's due to just the diet and the exercise that I did, which really helped me, go through menopause pretty smoothly, I would think.
So you have these symptoms like palpitation, tachycardia, nervousness. How you differentiate, is it menopause? is natural thing versus something serious like you want to have a heart attack or something like that?
Well, testing is probably the best way to know for sure, as well as your history. Obviously, if you've had a past history of cardiac issues or you're diabetic.
So you think after 50, the woman goes down or goes up?
Up.
Up. Awesome. Awesome. What do you think about Seneca? Do you think that would happen to you?
Yeah, once I realized that I was in menopause, okay, I have to deal with this. I started to do hormone replacement therapy, which did help. It helped with the sleeplessness. It did help with the night sweats. The energy level was already there and it did not decline. I was able to continue activities I've always enjoyed, and I felt like I didn't miss a beat because I had the hormone replacement. And I did notice that when, you're supposed to take them every so many months, but if I was off by a couple of weeks or a month or so, I did notice a decline in not being able to sleep as well, which really kept me on the hormones therapy. But it did help. It helped me out tremendously, along with supplements. I'm an advocate for supplements. I always have been my whole life, and eating healthy. I think a combination of all of those really helped me maneuver through the whole getting to the other side of menopause. So I'm a prime example that, you can go through it and with minimal scales on you. So it was good for me.
So I'll be able to answer that in what, 4 to 7 years?
Yes, Dawn,
So-
you're in the middle
so
of it.
Dawn, did you take extra responsibility that now I'm on my own, now going into it, maybe doing extra work, doing extra responsibility will help you keep you busy and stay on the course?
I did, yeah. I took more of a natural approach. Just, lifestyle change, eating healthier, more water, more sleep, taking more time for myself, trying to exercise more or walk, and taking some vitamins. Is what I've decided to. That's what I'm doing right now. We'll see how that.
That's good. Very good start.
So let's talk about nutrition. So Albert said believe that most of the problem can be solved by lifestyle change and nutrition. So if you entering into the menopause, what is more important? What need to go in your mouth, and what we should avoid what should we favor?
Yeah, the nutrition is focused on a couple of things. You want to kind of be strategic. It's focused on maintaining a healthy weight. It's focused on maintaining a healthy blood sugar, with insulin resistance being a little bit more prevalent during perimenopause and menopause. So that's why you want to focus on the blood sugar, keeping that stable. And then it's functioned on food that helps with stress management, with sleep, and with hormone balance. So many people are aware of the Galveston diet, which was designed specifically for perimenopause and menopause. So that's very nice to access. And those lists of foods there are supportive in a couple of different areas. So for example, let's take magnesium threonate. That's a specialized form of magnesium that we believe crosses the blood-brain barrier, so you get good neurological benefit. It's going to help with calming, with sleep, with muscle relaxation. It's a supplement that you'd want to take at night, especially if you're having difficulty sleeping at night, or if there's a lot of muscle tension, you work on a computer, you're sitting in front of the screen all day. It's nice to be able to relax the neck and the shoulder muscles, and magnesium threonate will help with that. And also help a little bit with the anxiety or the anxiousness feelings, or some of that rumination, riding thoughts at night and problems over and over in your mind, keeping you from going to sleep. The fiber helps with blood sugar control, most notably, and also with elimination, because it's important to eliminate regularly with good, healthy bowel movements. It helps to maintain the weight. It helps to keep your system detoxified. And the edamame, which is listed as number 10, is a soy-based food, and it's not processed, because edamame is just the actual soybeans, and you can certainly eat those. Good protein and good source of healthy soy.
So it looks like Galveston diet is almost like vegetarian diet, except fish. There's nothing else included in it.
You do want to have a plant dominant diet. It doesn't have to be vegetarian or vegan. It can be, but it needs to be plant dominant so that the plants take up about 2/3 of your plate and the protein source takes up 1/3. The protein can be fish, but you can also get good protein from vegetables. And then, of course, if you want to go into red meat or beef, pork, other forms of poultry besides chicken, that's also great to keep a good protein intake in the diet. You just want to keep clean as possible. So you want your foods to be organic, grass-fed. Those are extra bells and whistles that if you can bring that to the table would be beneficial in getting a quality protein source.
So let's talk about, I've done my lifestyle change, walking every day, sleeping well, eating right, and still having symptoms.
Yeah.
So can you help me to select what I need to go supplement-wise, which can help my heart pressure or my weight gain or my anxiety or sleepiness or night sweat? Is it something to do with related to supplement? Which supplement work for what?
Yeah. So supplements are the world of plant-based medicine or plant medicine called botanicals. And often they're Chinese herbs. And we have a list of those, which I think everybody can see. And usually the focus is hormone modulation or balancing, and hormones being female or male hormones, and stress hormones. That's sort of the main focus. So most of the herbs there are, for example, the maca would be on the stress side more dominantly, but also on the female hormone balancing side. Whereas the number 5 would be more on the estrogen focus side, but also progesterone and testosterone. Dan Quai mostly on the estrogen side, Chase Treeberry mostly helping with progesterone. So kind of depending on where you feel those symptoms are occurring, for example, if it's hot flashes and night sweats, it's going to be a little bit more on the estrogen loss side. So you want those herbs that are going to bring more estrogen in.
Which one is that?
Dan Quai would be a good choice there.
And if you have more like sleep problem,
Yeah.
then which one would you go for?
Maybe the Chase Treeberry for getting more of the progesterone support, which has a sedative hypnotic effect, progesterone. And maybe even the ashwagandha, because that helps with the stress part of not being able to sleep well.
So now we have a patient who has tried lifestyle, have tried nutrition, and have tried the traditional supplement, and is still having problem and looking for some help. So should they go to specialists? Or how do you find a specialist who just focus on menopause, or primary care doctor or OBGYN? So what would be, what are the steps, and how do you go through that?
Yeah, I think if you have an established relationship with a healthcare provider, you already have a primary care doc, you already have a family physician, you already have a gynecologist, you can certainly start there. If you don't, you probably should at least start with your primary care doctor to do a general health assessment and then focus a little bit more on the chief complaint related to menopause. So once you get to your healthcare provider and you share that history with them and discuss your symptoms, they can begin to help you diagnose and then navigate the menopause, looking at all the options, be it botanicals, be it medications, or not taking either.
So you are the expert in menopause, and you get referral from the OBGYN and primary care physician, or patient come to yourself because they couldn't get any help. So how you approach a patient who has gone through simple thing, couldn't resolve the issue? What is the assessment checklist?
Yeah, so I have a little checklist provided. It's nice for patients to go through the checklist and answer those questions to kind of streamline their visit with the doctor and really focus on the key issues. But as a provider, I'm really looking to assess the safety of making decisions with regard to hormone replacement therapy specifically. We always want to be in a situation where the benefits outweigh the risk. So your provider needs to understand you and your medical problems, look through these questions and your answers, and help you navigate what is the safest choice for you moving forward.
So let's talk about hormonal therapy. So when you go to hormonal therapy, which is, a lot of people, we basically don't like the idea of, most of the studies have shown that hormone, especially hormone replacement, say estrogen replacement, cause heart attack. And most cardiologists will not give hormones to their patient. What you have to improve the safety criteria in patient like Seneca, she want hormone therapy because her symptoms are worse. So before you give it to her, what do you need to know about the patient?
Well, there's criteria already set. North American Menopause Society has criteria, and so there are guidelines that providers can use. If you're a cardiologist and you've got a patient with heart disease, you certainly need to navigate carefully with regard to that. It doesn't mean you cannot take hormone replacement therapy, but you don't want to put a patient again in a situation where you're adding a medication or a hormone that could potentially increase their risk of heart attack or blood clot, because you can have a blood clot as well. For Seneca's healthy and normal body weight and physically very active. She'd be an easier person to counsel because she's not bringing any big negatives to the table. So you want to always look at breast cancer risk. You want to look at your breast cancer risk separate from, the risk that hormone replacement therapy may bring with regard to that in terms of estrogen.
For breast cancer risk, you just do mammogram or do BRCA1, BRCA2 or something else?
The family history would determine whether you need to take a deeper dive on the genetics. And sometimes people already know their genetics with regard to breast cancer because they've had a family member that's had it. But that's not something that you would do just automatically on everybody. It really is history dependent. But you want to look at cholesterol, and I've got a list here, most commonly not prescribed or ordered test. You want to look at hormone levels. That's from FSH all the way down to DHEA. Those are female and stress hormones. And then you want to look at thyroid hormone because the thyroid hormone dances with the female hormones, particularly estrogen and progesterone. And very often you can have an underactive or a hypothyroid, and it's influencing your menopause symptoms or your hormone levels. You want to look at lipid panel or cholesterol because if you've got heart disease or you just have really high cholesterol, that's bringing a pretty significant risk factor to the table, and you'd want to navigate carefully with regard to decisions on hormone replacement. The blood sugar and the insulin, the A1C, is looking for the diabetics and the pre-diabetics and those that are insulin resistant and have insulin resistance, maybe experiencing weight gain because of that particular issue, as well as hormone imbalance. HOMA-IR is also an insulin resistance test. Those should be done. Of course, your routine labs that your primary care doctor is going to do to just rule out general problems with kidney failure or liver problems. All that should be assessed. Risk of Alzheimer's, risk of heart disease via the ApoE genetic test, the methyl tetrahydrofolate reductase, MTHFR test is a good test to look at your risk of having a blood clot because you're more likely to have an elevated homocysteine level. That information is critical because we know that estrogen can increase your risk for blood clots in the oral form, and you'd want to have that information before making that decision. Inflammation markers, breast imaging, and of course a GYN exam. Got to make sure that there's not a tumor or a growth or a fibroid or endometriosis or something that would influence how you prescribe the hormone therapy, or if you prescribe it.
So Dr. Jones Bailey, tell me about testosterone level in female. Why do you do it? How is it related to the function, and why it's important?
Testosterone is a hormone that's produced by the ovary. So it is an important female hormone. It doesn't get as much press as the estrogen and progesterone, but it is an important hormone. It does not often decline as dramatically as the estrogen and progesterone during the transition, but it can still decline. If you have PCOS, you may already have a high testosterone level. Then you have menopause and it drops down. So you might feel the symptoms in a more dramatic way because you're used to having a higher level. It's important for libido. And so the recommendations now that are agreed upon in the literature are that testosterone replacement can be used to treat hypoactive sexual desire or problems with low libido. So it is another hormone that you can bring to bear, particularly for those symptoms.
Tell us what new medications come up for female, for low libido.
There are some FDA-approved medications for low libido. Veoza is the newest FDA-approved medication. People use others like Brisdel, gabapentin. There are other drugs called selective estrogen modulators. So these would be various non-hormonal or non-directly hormonal tools to use for women with those issues, or even with just the combination of low sexual desire and the menopause symptoms.
Very nice. So hormonal replacement therapy had a bad reputation initially, and then now it's coming back. You think it's coming back? So what he's saying to what I heard today is that if you have symptoms, the woman needs replacement, but cautiously, understanding whether the risk of heart attack, risk of blood clot, risk of other complications, and as well as also check for testosterone level in women to see whether they need replacement. Is that right?
Yes.
Okay. Very good. So let's talk about other aspect of menopause. Like, women live with men and men live with women. So if woman is cranky and moody and depressed, it's going to affect our life too, men's life too.
Yeah.
So give me some hint to other side, like a male side, that as a father or as a husband or as a brother or as a friend, that when you see a woman suddenly change her mood and start talking differently and behaving differently, not happy, lose interest in work, what can they do? I mean, a woman should say, listen, no, please stay away from me, I'm going through menopause. Would you say that, Dot or Seneca? Have you done that?
I didn't do that either.
Why not?
Because I go ahead, Don. I have my reasons.
I mean, I announced it. You're right. I said they're telling me I'm in menopause, but there was a lot of just really support and just kind of looking over things when I was in those types of situations.
People around you looking at you are in menopause and they supported you.
Yeah, because I was always talking about how hot I was.
So Dr. Jones Bailey, how are the people like me who does not recognize the symptoms or things? What advice would you give?
Well, it's not so much about you, newsflash. It's about her and how she's feeling, a loss of control, emotional, making this transition. So be patient. Don't be judgmental. Try to open a discussion about it in a non-confrontational way. It is a normal transition. So, be mindful of that.
It's really a lot easier for me if they tell me,
Yeah,
that would be a lot easier. Wouldn't you say that? Maybe you help them?
And I think the average husband who really loves his wife will be very supportive.
Yeah.
That's what did you find that to be true for you, Don?
Yeah, of course. Not be something that you want to announce, right? I mean, you don't. I mean, close people, yes, but not just. But it affects you in every way, right? Like every possible way, every situation. Sometimes you can't control it.
Yeah.
So, what about the situation where one person want this, another person say hell no? How you resolve that?
The normal way.
And what is that?
Communication, compromise, respect. Yeah, I mean, it's an interesting time depending on the age, right? Because if your husband is a little bit older or even your same age, he may be experiencing hormonal transition as well. So we want to kind of recognize that possibility.
So this topic, nobody would talk much about it, and so tell us about how is your responsibility as a provider or caregiver to bring that topic back in communication. A lot of people don't talk about it.
That's true. Yeah. Yeah, certainly you have to have a healthy relationship. And so the components of that would include you discussing what you're dealing with mentally and emotionally and from a health standpoint. We've got a seminar coming up about this topic with my practice, Buckhead Functional Medicine. It's on February 8th. We will be providing, I think there's a QR code coming up that you can sign up for that. But we're going to talk about sexual health in later years because that seems to be the biggest challenge, particularly for the men, but for the women too. Because when the later years, I'm meaning menopausal and postmenopausal, there are lots of things happening during that time besides just the hormonal changes and the emotional changes. There are physical changes. And learning about that and how to navigate that is important for couples.
So how people get registered if they don't have a QR code?
They can either call our office, 678-428-1653. They can go to the website, www.buckheadfunctionalmedicine.com. They can send an email, buckheadfunctionalmedicalgroup@gmail.com.
So to register, they have to go to your Facebook, right? How do they go to your Facebook?
We have a Facebook page under Buckhead Functional Medicine.
So you go to the Buckhead Functional Medicine and then go to the Facebook, click on Facebook, and then register here, right?
Yeah.
So the only people register get this invitation, right? Otherwise, you did public, and anybody can go there.
Yeah, well, we've got our big database of our current clients and past clients, and so they will know about it from constant contact. We've sent notification.
So that's very good. I'm glad you're doing that, and hopefully, a lot of our listeners will take advantage of this knowledgeable thing to do. And so, what are you going to talk about? Can you tell us a little bit?
Oh,
No.
yeah, I can tell you.
Okay, a little bit. Yeah.
A
So
little bit.
so the people can come up.
We're going to talk a little bit about the changes that occur in menopause. We're going to talk a little bit about the changes that occur in andropause, which is the male menopause, and how to navigate that really through communication largely, because sometimes that's the biggest part of the problem. But also what tools that you have to navigate, both medically speaking and supplementally speaking. So we're going to give you the tools as well as the knowledge.
Thank you. So let's talk about the questions we have. So I think Judah has put out those people who are going to attend this meeting could put those questions, and then he organized those questions. And most of the questions we'll bring it to here. One of the questions was the hot flash. How to deal with hot flash, and what is the cheapest thing on over-the-counter medication or supplement people can take to relieve their hot flashes. Dr. Millie Jones?
Yeah. I'd be interested in seeing what the ladies used for relief of their hot flashes too.
Tell us about Sanika. You had a hot flash, right?
I did. For me, I just think I discontinued with lots of supplements and actually with choice of clothing.
Right.
Choice of clothing, just like nighttime, just wear something that's very, very thin. I always had a fan in front of my face. I think we all done that. that really, really helped, and just continue exercising and just pushing through. And I do eventually it would be over, but it took time. I did get used to it. It was my new way of life, and it was I think a woman's passage of becoming an older woman, I would say. I think I've weathered the storm pretty good.
So, Don, what's the big deal? It's not going to kill you, so why not let it go?
Well, I basically have on hot flashes or the night sweats. I just either, take off covers or let a window up or use a fan, or I haven't taken any supplements for it.
Okay. Well, they've got some pretty cool cooling pillowcases and cooling pillows. And then they have mattress toppers that are cool. So you do have those options. You can use your supplemental, like Seneca was saying, herbal options. So your Don Quine, your black cohosh, and Chase treeberry, and the supplements that were listed there will dial things down a bit for you. Yeah, I think those are probably pretty decent tools. Of course, you have hormone replacement therapy.
I don't get hot flashes, but I'm still, at nighttime, I'm still like, I'm hot, he's cold. And so got to find that happy balance. And so I still deal with it, but it's just not as severe. It seems like he's always cold, I'm always hot. It's still work in progress, even way on the other side.
That is a really good point.
Yeah.
I think people think there's a switch, and it really is not the case. You will still have some symptoms intermittently.
Yes.
That'll come and go.
Yes.
Like a hot cup of coffee may stimulate a hot flash. Getting flustered in the car during traffic might get you a hot flash. So there are little triggers that happen along the way that may kick a couple of symptoms up, and then it'll go back down. So that's a really good point, because I think people don't always know that.
I just thought it was just me. It's like, why are you always hot all the time? I'm like, I don't know.
So one other question was, during menopause, the weight goes up. People start gaining weight. So how to handle it, how to lose weight during that time, how to keep your weight down, and how to make sure that the weight doesn't go beyond where you want to go to.
That's probably the number one reason people go to the doctor for menopause. It's like they'll deal with the hot flashes, they'll deal with the moodiness, but then when the weight starts coming, or the number two would be the hair getting thin or falling out. Those would be the two reasons.
So what is the reason of weight gain? Because of the appetite increase or food increase?
It's multifactorial, but it's definitely a thing. I think it's they quote 1.5 pounds per year during the 50 to 59. I don't know. I think it's probably a little bit more than that. But
Definitely more than that.
Yeah.
So
1.5. Yeah, which is kind of interesting. That's Mayo Clinic data.
If the nutrition and the lifestyle doesn't work to control the weight during that time, is there anything else we can do?
Yeah, you need to take a deeper dive. You want to make sure the thyroid's normal and you're not hypo or underactive thyroid. And you really want to look at that blood sugar dynamics with the insulin and the A1C and the HOMA-IR, because this is a time where you'll go into insulin resistance. So, and if you've had insulin resistance before because you had polycystic ovaries, it'll actually get worse. So that will be a weight gainer because you'll crave sweets. Your fat will go to fat storage mode instead of getting burned up in the muscle. So it's really a very critical thing to evaluate for weight gain.
And the other important question was the mood change. They basically mood changes and they don't have control on it. They can explain why their mood changing. They don't know why they're behaving differently. And it's a very common thing. And a lot of time people don't realize that. So once you realize that, is there any way you could handle that better?
Yeah, I think you have all the typical tools. Make sure you get to sleep and get enough rest, which is hard because if you're having hot flashes, you may not be sleeping well. Use all those stress management tools, prayer, meditation, yoga, talking to family and friends, anything that's going to help you sort of download that stress a bit. Recognize that this is where you are, so that you can sort of be proactive in avoiding situations where you think you're going to get super flustered or going to get super upset. And for some people, especially if you're working, you have meetings, you have stressors that are happening, and sometimes it's difficult to navigate that. So keep your mouth shut.
So do you think the hormone replacement therapy can change the mood?
Absolutely.
Okay.
Yeah, the estrogen particularly acts as what we call a neurosteroid, so a brain steroid. It also upregulates serotonin, the antidepressant neurotransmitter. So yeah, that is
Does
definitely
it help with the weight gain?
If you're happier and then you exercise.
So it's rather than losing job versus replacement therapy, right?
Pretty much.
So one of the questions was that what is the relationship between coffee and wine during menopause state? Any relationship there?
Yeah, I think that coffee is more on the caffeine side, and caffeine is a stimulant.
Mhm.
So, there are pluses and minuses to continuing to use stimulants. Now, we understand that you're not sleeping, so we understand that you're tired, so you're going to be looking for that coffee. But you might start with 1 cup, and then it's 2 cups. The next thing you know, you're up to 4 cups, and you're, just trying to keep yourself awake and stimulated to get through your day. And so that's where it could be a problem if you're overdoing it or you're becoming addicted to the caffeine.
So let's deep dive a little bit on hormone therapy. So tell us about the easiest thing to do. Is like cream, topical, or tablet, or it is pellets. What is the?
I wouldn't say the easiest, and that's where your healthcare provider is really going to help you navigate. The estrogen in the topical form, be it rubbing it on, putting it in a patch, or putting it in your vagina, is going to be the safest if you're avoiding the risk of blood clots. So you do want to go there first off in your estrogen replacement. The testosterone, if you're having the low sexual desire, you never want to replace that as an oral medication because you're bringing risk to the table with blood clotting. You want to do that as a topical form because men use it as a cream as well. You could do it as an injection, or you could use a vaginal insert. And then the progesterone kind of depends. Progesterone comes in an oral pill, progesterone comes in a vaginal suppository, and progesterone comes in a cream. It does come in an injection too, but we only use that in obstetrics. Progesterone as an oral breaks down into another hormone that is really a great sedative hypnotic, relaxation, drifting off to sleep. So if that's a big part of the problem, the oral form may be better. If it's more just the moodiness, then you're better off with a cream or a topical. We often use the cream or the topical for PMS. So it's really good for the mood stabilizing. And then you could do a combination. I have some patients who were doing combinations.
So when you want pellets?
Pellets is just another form of hormone replacement. It is a stronger form. They're look like grains of rice. There's an estrogen pellet and there's a testosterone pellet. There is no progesterone pellet, and there's no DHEA pellet because we haven't talked a little bit about that. The stress hormones, DHEA and cortisol. So you just have 2 choices for pellets, but they're much stronger than you could apply on your skin or take in an oral form. So you get a little bit more bang for the buck. You get higher levels. You get more sustainable levels. And then the trade-off is that there may be side effects just because you're coming in at a higher dosage.
So once you take pellet, then you forget about medicine. You can last for about 3 to 6 months, or
correct, 3 to 6 months. Well, the pellets themselves will only last about 3 to 5 months.
Okay.
And so you'd have to put them in again, and you'd have to monitor hormone levels so you know that the dosages are correct.
So Dawn, you have a chance to ask any question you want. Dr. Jones very here.
So I guess once you make it through that transitional stage, whether it takes 4 to 7 years or 2 to 14,
Yeah.
and you've gone a year
Yeah.
without any menopause or anything like that, does it just completely stop? Like
No.
everything goes away?
No.
No. So it takes time.
Yeah, so the most dramatic symptoms may be dialed down a bit, but there are triggers to bring those back. But then you're looking at the longer term effects of low hormone levels, estrogen and progesterone. So now you may have frequency of urination, vaginal dryness, decreased libido, recurrent urinary tract infections. So those are more symptoms that are coming to play because there's been a longer time that you've been without your hormones.
So let me ask that question again. Which is worse, menopause or post-menopause?
I don't think either one is bad. I think the symptoms.
You like menopause, you like post-menopause. To me, both look bad. Really.
Like I said, we're used to hormone transition. So I think that it depends on the person. But after menopause, it is difficult to navigate some of those symptoms as well because they're more long lasting. So maybe you could consider that being worse because we're living longer now as women. So we're going to have a longer number of years in the postmenopausal period.
So I need to just stay in menopause. Don't go.
So can you prepare yourself in menopause for post-menopause? I mean, same thing like lifestyle, nutrition, take care of your body, love yourself, things like that.
Yeah, and there are treatments for vaginal dryness that are non-hormonal. So you have things that you can put inside your vagina to promote moisture and blood flow and to keep that area fairly vitalized and moist so that you're not having the dryness or the recurrent urinary tract infections. So there are tools to navigate that postmenopausal time as well.
So I just want to thank our audience to stay with us with non-functioning YouTube. All right?
So night sweats, you just feel really hot and you just sweat. You may have to take the blanket off, get up, put a fan on. But a hot flash actually starts sometimes in your stomach, sometimes in the chest, so it can come all the way up to your neck and your face. You get really flushed. And you feel like my heart races when it happens. I get anxious and get palpitations when it happens. Not everybody does, but I do. And you feel like you're just on fire, and it can last anywhere from 3 minutes to I've had it last for what felt like an eternity, but I'm sure it wasn't. It was probably like 5 or 6 minutes.
Well, final recommendation from Seneca and Don and Dr. Joel Bailey.
Well, as for myself, I'm well on the other side of menopause. I am 66 and gone through it.
You sure you?
Yeah, I'm 66 years old. I'll be 67 in July of 24. And so I've weathered the storm. Some parts of it wasn't that easy, but I just think if you just, consciously for me to eat really healthy and very clean, limit your alcohol intake, supplements, like I said, have always been a part of my life, and exercising. And sometimes it's a conscious effort that you have to do it, even though you don't want to. But if you want all the wheels to really work, you have to spend time working out, eating healthy, and it's just really helped mentally. I felt better. And sometimes I don't want to take the supplements. Sometimes I don't want to go to the gym, but I want the outcome to be good. I want to keep my weight down because I know if I keep my weight down, that I don't have to deal with diabetes and all the other comorbidities that we all deal with as we get older. So I say that, you can all look great at 66 and still be healthy and mentally and exercise and go into your, to be 100. Like my grandmother died at 104 and my mother currently is 90. So, it's not all bad. So Don, what about you?
I think it's probably just individually, whatever's going to work best for you. I'm taking the path that I feel like is working for me currently. That may change. Maybe, definitely go to your doctor or doctors. I talked to my primary care and my gynecologist and, do some research. I've researched every single vitamin that I can find on the internet right now. Also when I go to Kroger, my husband finds me in the vitamin section. I'm looking for something to help with some kind of symptom that I'm having. So I think it's just where they got to figure out what's going to work best for them.
Introduce Millie.
I mean, it's a normal transition of life. I think the good news is that we have some newer literature and reevaluation of the original Women's Health Initiative in 2002, where we were all scared to take hormones or do anything, that now tells us that we do have safe options for management of menopause, and hormones is one of the tools that we can bring to bear. And we also have some long-term literature on patients who are and taking hormone replacement therapy, and the profile of that woman is emerging. And what we're starting to see is some of the health benefits on the other side, which is, maintaining a healthy body weight seems to be more common in the women that are replacing hormones. They're more physically active. They're less likely to have osteoporosis, less likely to fall, and then have morbidity after that first fall. They're more engaged in their community. They tend to be working part-time or in some capacity. So that profile of women is emerging, and the information is very, very positive. So if you can navigate safely this journey with hormones, with supplements, with herbs, that's certainly the way to go.
Well, thank you very much. I hope you learned a little bit about how to handle menopause and postmenopause. And I would recommend that with new demand of world where they expect a woman to take over the world, and it looks like the what we call Nari Shakti in Hindi. So woman power is coming up, and more these women will run the world and run our lives. So we wish them best. Hopefully, learn from this conversation and join the Health Well Safe community. Please go to the website and ask any question you want to. And Dr. Jones Bailey will be happy to answer those questions. You ask her, and she's available for a consultation in Bucket, Functional Medicine in Bucket, in Atlanta, Georgia. And thank you very much for joining this webinar.
And thank you, Dr. Agrawal, for inviting me for this wonderful discussion. Very much needed.
Thank you for joining our webinar. Be sure to follow us at Health Wealth Safe on all social media platforms so you can stay up to date with new healthcare technology. If you have any questions, please email us at info.healthwealthsafe.com. And remember, your health is your greatest wealth, and we want to help you keep it safe.